this big time transformation, we're 4 weeks in and a day now, is that right?
Correct.
Just about a month.
Yeah.
From your perspective, how has it gone so far?
Well, so far we haven't had any large issues that we haven't been able to work in this managed care transition. And it's a significant transition, moving 1.6 million people from a fee-for-service system to a managed care system where there are 5 of those managed care entities providing oversight for our system now. But not issues that there are issues that we've been working that concern us, but nothing that has been overwhelming our system.
How many denials are we seeing roughly, and why?
So it's multiple reasons, and taxonomy really is just part of the billing process where you have to say what kind of provider you are, essentially, is in that taxonomy code. And we don't have all of the exact reasons, but we believe several things happen. One is that when people move from our fee-for-service system, they were submitting directly to our system of record, NC Tracks, one way. When they move to these 5 health plans, they may have changed something in the list, so it might have picked it off or seen it differently. I often equate it to as when I go on Amazon and order something, I have all my information in there, but if I try to use the same information with another site, it might kick me off because it feels look a little bit differently. So some of that, and then there are some things where people maybe not have updated their taxonomy information over the course of the past 4 years, and when they shifted a new system, it might have been kicked out. But it's those kinds of really technical issues that really have been sort of the heart of that issue as people are feeling it.
And I know that in talking to several now, we've talked to at least a handful of different specific speech therapists. They say that they're experiencing, in some ways, 5 different ways of doing business with these 5 different companies. Has it been an issue streamlining this?
It's a great question. We've tried to do as many things as we can to streamline this transition, but the one thing we can't change is that there are 5 plans now where people bill rather than 1, which was us. And although most of the plans are trying to do things to be as consistent with each other, but each one of them brings a different platform because they are, national organizations who do this work across the country. So you are seeing that, and I think like any insurance, it'll take a while for people to get really comfortable with that. But we believe that 1 is that the plans are working closely with them, and then 2 that as folks have more experience with it, these things will smooth out.
You mentioned the really technical kind of issues that seem like clerical that are leading to denials. And it sounds like you're suggesting from the provider's end, just some information may not be into the system correctly. How many of those, how wide ranging are we talking about?
It's hard for us to tell. What we do is that we don't know, one is that how many times we don't hear about it, right? So that's one thing. So we have asked people to work with their health plans directly to do that. So but we get a significant amount of tickets that come in that tell us that stuff. I don't have the exact number on it, but they're significant, right? We get this information. Our team works those pretty rapidly with those health plans to try to address those. What I would say is that the number that we received actually is less than we would have anticipated with this transition, but there are very specific providers that are having more difficulty. And I think some of what I would describe, some of the smaller specialized therapy providers in particular seem to be having more difficulty. And that might be because the health plans haven't worked with them as much in other places. And again, it's a big transition for them in this move.
And we're talking about really small businesses, like,
yes, we are. Yeah.
Super tiny that, we're not used to having to hire a billing person to handle their billing, right?
That's correct. You have that happening. And there's probably another issue that gets conflated here is that there are some of these providers actually something we was it infant and toddler program. I think you asked about at one point. They provide contract services for the state agency that does that work. Originally, they were intended to be inside of managed care. At the last minute, inappropriately, the General Assembly removed them from that, so they're carved out. But we had programmed our system so that they would be in managed care. And frankly, from the state standpoint, it's taken us way too long to program the system. But we believe by August 16th, that'll be correct. And what we've said to those providers that if they are having cash flow issues, we can provide what we call as a hardship payment, basically an advance on those billings. Today, we've had we've had 17 of those requests come in that we've honored. So we're trying to make sure that none of those small businesses are put in a position to where it causes a problem with them with payroll or any other bills that they have.
So you really have two layers. You have this big time transformation, then you have this last minute change that the state hasn't really pivoted quickly enough on.
That's correct.
In talking to several different kind of speech therapists, you know, they're having issues. Number one, with reimbursement. For whatever reason, they are not getting paid. It's been a month, they've not received payments. How is that acceptable?
It's not. I'll say to you is that, you know, when we let me sort of talk about our priorities, right? Our number one priority is that people will continue to get seen as this transition happened, and those providers are doing exactly that. The second thing we committed to was making sure those providers would be paid. And so why I mentioned the hardship payment is that what we committed is that either the health plans themselves, if they weren't get paid, would do these hardships, or if they weren't, we're the backstop, and Medicaid will make those payments available. So again, 17 is a relatively small number, but we think it's the number of folks that actually today need those payments to make sure they're hitting payroll. So it's not acceptable. We're fixing it, but we also have the backstop, if you will, of that hardship payment that's available for those providers.
Now, is that hardship payment available for anyone in Medicaid right now, any of the managed care?
Yeah, so how we're pushing it out is that if there's a provider and they are billing the health plan, we've told our health plans, we expect them to do the same thing. If they can't get a payment out, providers having that difficulty, they'll have those hardship payments inside of managed care. If it's a Medicaid direct issue for us, we'll do it as a Medicaid program. But frankly, if we have providers in a place to where they can't get paid, health plans can't do it quick enough, we're prepared to be that backstop as well.
That's good to know. And I'm going to certainly tell the people that have reached out to us immediately today that that's an option for them if they need it. I know some of the smaller ones are really kind of concerned, which leads me kind of to my next question. In talking to some of these businesses, they have a real fear of having to put some kids on hold of seeing their services if they are not going to get reimbursed. What should these businesses tell their patients?
Well, I think the most important thing for them to do is to let us know. If they're at that place to where they believe they can't take patients because they're not getting paid, we want to know, because that's not something that's acceptable to us. Certainly not acceptable to the folks that worked on this managed care transformation. And I know it's not acceptable to health plans either. So let us know, make sure that we're aware of it so we can address those issues.
And they know how to get in contact with you all, these providers.
We've had the information out there a lot. And again, if they can't, you can give them my email. So
cool. And kind of just in closing, obviously this has been years in the works, right? And I think that like from a very general, broad perspective, I think everyone sees it a little bit differently. Like North Carolina Healthcare Association isn't ready to call it a significant concerns yet, right? There are certainly some parts of this transformation that have not gone great by your own admission, right? But overall, it sounds to me like you feel like this is better than you thought it would be. I can tell you based on the people that I've talked to, this is worse than they feared. And when you've had years to prepare for this, how do you explain that to them?
I think it's a great question. And I would say, you know, prior to coming to state government, I ran an organization that provided services. And if I was the organization that wasn't getting paid, I would feel exactly as they do. So I want to be clear is that there is nothing of this is acceptable to them. But when you think about a transition this big, right? When you have 1.6 million people, you know, large amount of money changing in terms of shifting this side, 5 new health plans in the mix. The transition has gone relatively smooth. And I say that because relatively is really important to describe that. We've got issues around other places where we're worried about beneficiary impact, and we don't want that to happen. But again, 1.6 million people, the vast majority of those transitions have gone well for those individuals. And what we're trying to do is make sure that we work on these that you're raising and others raise, get them addressed and fixed. There'll always be a problem, right? But make sure we get that as smooth as possible so that we can see the benefits of this transition in the coming months.